Hello, everyone. This is Dr. Michael Kachmar. Sorry we didn't have the audio there.
No,
Hello, this is Scrubbing Up with Dr. Michael Kachmar. Today's date is, what's today's date, Jeremy? Today's Friday, the 21st.
That's right.
The year of our Lord, 2020. And
2022.
2022, excuse me. Haha, I do that. You see that? 2022. And today we're here. We have Jeremy. Say hello, Jeremy.
Hey, everybody. How you doing? I'm your old pal, Jeremy. You know me and you love me, don't you?
So this is Scrubbing Up with Dr. Michael Kachmar. This is a video podcast, medical talk show. And we are right now live on YouTube, Facebook, Twitch, Twitter. And also we go to podcasts on Spotify and Apple Podcasts. Also, we just got onto Rumble, so we should be doing Rumble next week. And this is a radio.
And we're broadcasting from the Kachmar Network.
Yes, the Kachmar Network. That's right. That's right. And we have a great show today. We got a good case of the week. We're gonna talk a little bit about politics and then a lot about medicine today. But Jeremy, can you just tell people on our podcast and people who are watching you, if you want to get a hold of us, we have a email address that we strongly recommend that you send an email for. So it's Dr. Kachmar. That's Kachmar.
It's right there on your screen, folks.
For the podcast people, they can't see it, but at iCloud.com. So,
and for those of you who are only listening to our audio, you're only seeing a fraction of our show. We are a full video podcast. So if you want to catch that whole video, you can see us on YouTube. You can see us on Facebook. You can see us everywhere, but some of the podcasts are audio only, and but we're trying to get more video opportunities out there so you can see everything that's going on in here.
Yeah, and do us a favor. If you're on YouTube right now, subscribe,
and then there's a little bell there.
Hit the bell.
Some of you know about it, some of you don't. You hit that bell and you'll get notified when we go live or anything. If we got news, we could just post that. But you'll find everything now and you won't miss a thing.
Right, you get personally notified by Jeremy. Yeah. Jeremy will call you up. In fact,
I'll give you a call.
And again, you can watch us on Facebook, Twitch, Twitter.
I'll be selling this shirt out front at the curb after the show.
So there's a lot of things people could do. So let's get right into it. I want to talk about a couple things here, Jeremy. Before we do it, one other thing. If people want to get a hold of us too, they could give us a call at our office, 732-269-1133. We have a medical practice. I'm on staff at multiple hospitals, and for
the
people,
master of podiatric medicine, right here.
Right. So I'm a doctor of podiatric medicine. I'm board certified in reconstructive foot and ankle surgery.
Yes, sir.
And I'm on staff at multiple hospitals. I do surgery in multiple hospitals, and
all the local hospitals here at the Jersey Shore. If you're injured, below the knees, and you need somebody who knows what they're talking about, who has seen everything, there are no surprises to this man. You can always ask for Dr. Kachmar.
Right.
That's the beauty of it, because he's pretty much he makes himself available in most of the hospitals and centers around.
A lot of our stuff is referrals from other doctors and family members. People who they've been all around. And they ask their cardiologist, they ask their orthopedics, they say, we've been to 5 other doctors, and they come to us.
Accidents happen, and you want the best man to take care of your loved one.
Right.
And that's Dr. Michael Kachmar. And trust me, he may be my bud. I may work with him, but the man knows his stuff. He's what they call a super specialist.
Right. And for people also, if they get confused, we do have another show it's called Lifeguards Off Duty with Dr. Michael Kachmar. That's my other hat. So you guys can check that out on the same platforms. Yeah. All right. So you
can see his old skivvies right over here.
Yeah. And Jeremy, put up the our webpage too, just so people could go to our webpage, the Jersey Shore Foot and Leg Center.
There's our webpage right there on the screen. Jersey Shore Foot and Leg Center.com.
All right. So here's a article. And I love this. This is The Guardian. The Guardian is probably the most progressive newspaper in the world. It's out of England.
Right.
Yeah, it's so far to the left.
Oh, I know the Guardian.
Yeah. So here, your parents probably, because they're in England.
Yes.
So here is a article just a few days ago from the Guardian. Well, this is the title: "I have no intention of getting infected. Understanding Omicron severity." So let me just make a couple of things. You're going to get infected with this, and either you're immune to it, or you're dead. You're going to. This is what happened in 1918.
So this person has a special pair of underpants from Krypton.
Right.
That prevent him from getting any earthborne viruses.
Right. Even Fauci's saying everybody's going to get it. So everybody is going to get exposed to it. Let's put it that way.
See, and that's the thing. When Fauci tells you everybody's probably going to get it, that's the truth I hear out of Fauci, because he wouldn't have admitted that otherwise.
No. Well,
he'd be saying like, my vaccine will protect you. Blah 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 blah. I'm science. Call me science.
Well, to say the vaccine is going to protect you is like saying, you know what, I'm going to go through that green light. I'm not going to look right or left because that green light's going to protect me. As if the guy who's drunk driving down doesn't see the red light.
No, because you got horse blinders on.
Right. But that green light's going to protect you. Here's the thing I just want to make, because I don't want to beat a dead horse with this. Corona.
Do you trust every driver out there, or do you kind of have like your eyes open and you're looking at your peripherals, your blind spots and stuff?
Yeah. So here's the thing. We're all going to get exposed to it.
Yeah.
We've been consistent on this radio show for 2 years now. If you have comorbidities, you're older, you're younger, but if you are at risk, you should get the vaccine. I got the booster, whether or not I'm going to get any more going down the road it depends. I got Corona during Christmas.
Yeah.
And I think that here's the thing. It doesn't matter if you had Corona or had the vaccine or had both.
Mm-hmm.
If you're going to get exposed to it again, and you might get sick again, especially with these new variants.
Yeah, that's the one. That's another thing we've learned, that if you've had Corona, you
get it
again.
Yeah, we're seeing that. Right.
Even with vaccines, you can get it again. Nothing's going to really protect you from it, but you may get more of a stronger help shield around you if you do have.
Right. Well, I could tell you this. This is my personal observation the past month. People who were vaccinated were getting sick. They were hospitalized, and some of them died.
Well, you told me the hospitals were packed.
Yes, packed.
That's something like
more people this time than the last time.
You hear it everywhere. You've heard it all year and last year, and you don't know what to believe. But now coming from you, Mike, that shook my world. Knowing that the hospitals are packed.
Everyone I know, all my friends, all my contacts, they're all sick. They all got Corona. Yeah. Here's the thing.
I had it. Everybody got it for Christmas.
Right. And I think that if you had the vaccine, you probably did a lot better. But not everybody. That's the thing about this virus. It's just so unpredictable. And going forward, I'm hoping that we see a lot of people now have more level of immunity. When they say about herd immunity, and I hear this being kicked around. I don't want to get into the definition too much, but basically, generally speaking about herd immunity, it's how many people that you'll infect if you get say Corona or the flu.
Right.
And so the more people that have been exposed, the thought is that it doesn't get passed as much.
Right.
Because you'll shake it off, you won't get as sick. And so that's the key. And also, too, the virus gets less and less toxic. It doesn't kill you as much. Mm-hmm. But my point is that we've had this big spurt. It blew all of the main thoughts of, if you've got a vaccine, it stops the virus in its tracks. This thing about the unvaccinated are causing the whole pandemic, or the unvaccinated are spreading. It's all bullshit. Everybody's spreading it, vaccinated, unvaccinated. I believe that the people who are unvaccinated, more of them are dying than the ones that are vaccinated, but it's not 100%. The only thing I could say, people, and this is what we want to talk about, and I'll finish with this. This mandate's not good. You shouldn't mandate anybody to get the shot. If you know what?
It stops being a free America when you mandate things.
Right. When you want to put people in jail.
Yeah.
Because they didn't get the vaccine. When you want to give them vaccine passports, when you want to do that, we're going down a slippery slope. because what's next? What's next? What are you going to make people do if they don't do it? So and what's the reason? Here's my thing. What's the reason for making somebody get the vaccine? Well, you don't want them to die. Okay. But we don't, if we're so worried about that, stop people from smoking marijuana or cigarettes, cigarettes, alcohol, I mean, and even pot, I can say right now, if you're smoking that stuff, cardiac disease is going up and up and up. So it's kind of being disingenuous. I think what we really need to do is let's be nice to each other. Let's work on, better vaccines, maybe vaccines that are safer, or forget about safer. These ones are pretty safe, but how about getting more science so we know that they're safe or not safe, or how, and especially for the kids. I think the kids are another whole issue. We really don't know yet where we're going with that. But going back to mandating, we should really mellow out. We should not be killing people, really giving them a hard time. The other thing is, I want to make one other point. I've had 5 people already who, some of them were vaccinated, some of them were not, and they're sick right now. They cannot get monoclonal antibodies.
Yeah.
And some of these people are very wealthy people, can't get it nowhere, no how, and that's a tragedy. And I want to make one point. Monoclonal antibody, for people who don't know, it's called multi-drug sequential monoclonal antibodies. About 8 of them are out there. And they were very effective. If you got sick, you go to the ER, they infuse you for about an hour or 2, and it turns you right around. And these are just antibodies against the virus. What happened is, with the Omicron, about 6 of those antibodies weren't as effective. So they kind of said, well, we're not gonna give it anymore. But I don't know if it's 100% not effective. But they could have made new antibodies. It doesn't take that long in the lab to make new antibodies. Why aren't we having this country saturated with therapeutics? And if you don't want the hydrochloroquine, and ivermectin, which people are getting locked up if they prescribe it. It's happening right now. I just showed you an article. Doctor got locked up, license taken away. She's got to go see a psychiatrist. But okay, I don't want to argue about that. How about something that the FDA, the CDC approves? The track record is 75 to 80% improvement, reduction, hospitalization, and deaths. Why aren't we have that all over the place? Why people in New Jersey right now cannot get monoclonal antibodies? And also, even if they had a ton of it, they were only if you were this age or that age. And now I hear it's if you're a certain minority. That's crazy.
Yeah.
It should be allowed. It should be so much out there, because if you didn't
why is everything still so secret? Why isn't it
more
transparent?
I don't know. But you know what?
That's what puts people off.
I understand that. I don't. That's a good question. I don't know. I think that
it puts people off a great deal, and that's where fear comes from. And then you got guys like the one you brought up who says, "No, right. I'm never going to get Omicron. I'm never going to get COVID."
Here's another article, USA Today. Okay, this is a couple of days ago. Right, my triple vaxxed 85-year-old mother caught COVID. Medical triage made her doctor useless. My triple vaccinated 85-year-old mother caught COVID. Medical triage made her treatment for the corona is a wild west. Prescription for the Ploxinoid, forget about it. Monoclonal antibody infusion, if you're lucky. This guy had to go. The article here, I'm not going to get into it. He had to go 70 miles finally get his mother and father some monoclonal antibodies, which does a couple things. Again, if you look at the CDC, right out of their literature, 65 to 85% reduction in hospitalization, reduction of deaths. Just in the hospitalization, you're lowering the stress on the hospital system. Also, these people turn around. Personally, again, my pastor, he has a Down syndrome daughter. She's 30 years old.
Yeah,
and a lot of times Down syndrome are obese. She was vaccinated. She got corona right around Thanksgiving. She was lingering on. She was getting sick by the 9th day.
How is she now?
Well, listen, she had pneumonia. She was getting bad. They were going to admit her to the hospital. But thank God, they still had the monoclonal antibodies. They gave it to her. She turned around in 24 hours. It was amazing. Yeah. I've had 8 patients, 8. 1, 2, 3, 4, 5, 6, 7, 8. that I operated on or I was treating, and during that course they got corona. I mean, obviously not from me, but they got it, in the hospital, whatever.
Yeah.
I sent them to the ER. This is before Omicron hit. They all got it. One guy called me up. He was 58 years old, not vaccinated, had difficulty breathing. I sent him there. He got the monoclonal antibodies. He told me, I remember this. He goes, Doc, within 12 hours, I felt 60% better. Now, again, these are general, and he's fine.
Yeah.
The guy wasn't vaccinated. Now, I'm not saying you have to get, vaccinated or not, and in fact, the guy, one of the people company who makes this monoclonal antibodies was saying that in their studies, if you get monoclonal antibodies, he says you got pretty good protection. He said immunity, but for 6 to 8 months. So, if people are hesitant, there's people out there who don't want to get the vaccine, or maybe they can't get it.
Well, and listen, just in the news last night, we lost Meatloaf, the bat out of hell himself, and because he did not want to get any vaccines, he was a jabless man. He didn't want any of it, and unfortunately, he was always a big guy. He still was by the end, I think.
Sorry, go ahead.
And you know what? He should have, because he was obese. He should have gotten them to, just in case, to save his life. And here's a guy who could have gotten the monoclonal antibodies. He could have gotten any number of things that would have prevented death. But it didn't happen for our boy Meatloaf.
No. So there's a good story, a tragedy, and you should have got it. But then there's people who get on and say, and again, I don't know these numbers. I see them. There's a thing where they track adverse reactions from the injection, and it's they say, well, there's about 20,000 people who had an adverse reaction within 1 to 3 days of the vaccine. Again, the CDC came out and said no. I always say this: life is a risk. You walk outside the door, it's a damn risk. You get hit by a car, you could, and a million things. If you have,
but poor Meatloaf. Here I am. I had two vaccine injections. I didn't get the booster, but like
it probably saved your life.
2 out of 3 ain't bad.
Right. It probably saved your life.
It saved my life.
Right. So,
that's it.
And I remember, Jeremy, because I have a good memory. You were like, maybe I shouldn't get it. The thing.
You knew I was on the fence. Yeah.
Well, problem with me is I don't sit there and go, you better get it, because I'm like, hey, listen, on the beach, I go, listen, don't swim there. It's pretty bad. And they're like, well, if you,
but as my friend, you do tell me how it is.
And I say, here's what it is. It's you weigh the things. Right now, you say to yourself, you're, how old are you, Jeremy?
I'm 47.
Okay. You're 47, you're diabetic, you're overweight, you're high risk. Bang.
Yeah.
Now, the vaccine is not, you're not most likely not going to drop dead from it. So the risk of the vaccine are lower than the risk of you getting COVID.
Yeah.
Because you're the poster child for people who die from COVID.
Right. Which was what scared me when I finally did get it.
Right.
And I was like, oh crap, I'm going to be a statistic. I know I am.
Right. So we said this last time. The older you are, the more the age and comorbidity. The older you are, diabetic you are, the more risk of COVID is. It looks like the younger you are and the less comorbidities, maybe there's a little bit more risk with the vaccine. Okay, we don't know. Nobody knows. If I sit here and tell you I know for sure, I'm blowing smoke up your ass. Yeah. I don't know. They don't know. Fauci don't know. Nobody knows.
Nobody knows.
Nobody knows. So let's be realistic. You got to make a judgment call. I have a patient right now. She's agonizing over whether or not she should get her 12-year-old daughter the vaccine. Okay, I'm not going to give her any advice. I say, listen, talk to your God, talk to your pediatrician. Look at the science. And it's hard. It's hard for people to go to CDC and look at these, articles. There's no easy answer right now. There really isn't. It's tough. I could tell you. The
CDC isn't 100% either, though.
Well, it's a government agency.
Their masks and agreeing for everybody to wear masks. They're going off of a study that is heavily flawed. So, you know,
well, listen, Jeremy,
they're not perfect, but
right,
nobody is in this,
nobody's
in
perfect.
this mess out there.
Nobody's perfect. Everybody's a sinner. You know, there's bias, there's misinformation, and there's incompetence, and there's greed. But we all know that. Here's the thing with with Meatloaf and the tragedy, and with everybody here.
How did you like Meatloaf's music?
Yeah, good. I loved him. I thought it was great. I love Rocky Horror Picture Show. I watched that a million times.
Yeah.
My
18th birthday, I was at the theater, Rocky Horror Picture Show. Everybody saying happy birthday to me. That was one of my best birthdays ever.
When I was in school in Philly, and
it was on Friday the 13th.
I dated this girl, and it was in South Philly. There's a theater there, and they showed it, and we went. That's the first time I saw it.
You had no clue.
No clue.
No clue.
There was people walking in. I mean, all dressed up. People in the audience, and what they did is they showed the movie and they acted it out on stage.
Yeah.
And it was an amazing thing.
It was amazing.
It was really what. And Steve Curry, what was his name? Curry. Who was the guy who played Frank? And
Tim Curry.
That guy's, he's an unbelievable actor.
He's brilliant. And he's always been brilliant.
Yeah. He's got a long career.
Yeah.
So I thought it was great. And Susan Sarandon, a couple other people in it.
Bostwick.
Yeah, Bostwick.
Brian Bostwick, is it? Yeah.
That's definitely something to watch. But let's end this thing with the COVID, okay? I mean, Jeremy, what do we got up there? We got 20. So to put things in perspective, because I want to throw this out, you're going to get exposed to it. Sitting home, and we talk about risk and everything. Yeah. You can sit home, with your masks and your shields, and you got to live. There's a song by Black Angels, I think it's called, the band, and it's called Young Men Die. And a part of the song that they say, you cannot live if you're afraid to die. Okay. And there's a certain level of risk that you got to take. I know people who, for the past 2 years, hibernated. They didn't see their grandkids, or the grandkids, they weren't allowed to see both sides. They couldn't see their grandkids. They didn't go anywhere, and they wind up getting corona anyway, and either dying or getting through it. My aunt, same. I tell you the story over and over. My aunt, she had corona initially. She was pretty sick. She had the monoclonal antibodies. One of the first people to get it. She was great. She's almost 80 years old, mid 70s. She refused to get the vaccine. She said to herself, I got antibodies. I don't need it. That's her choice. I thought in this country we still have choice. But you know what? Her whole family, everybody did ostracize her. They actually sent her nasty texts. You're an asshole. You're stupid. She wasn't allowed anywhere near the family for Thanksgiving, Christmas, nothing, birthdays.
But to paraphrase Meatloaf, she would do anything for love, but she wouldn't do that. Right.
Yeah. So what happens is, the funny thing is, Christmas now, all of these people on the other side of family who've been vaccinated, they got the soap dispensers, wear masks, they live in the woods, they isolated themselves, they all got corona. Yeah. They all survived. Everyone. So what the funny thing is,
walking past, like the UPS guy coming into your front door, he drops it at your front door, he coughs a couple times, goes through your front door into your house, you could get it.
Right.
Like, that's the thing. But, like you said, everyone's going to get it.
But here's forget about it. But I'm just trying to look at the humanity here.
Yeah.
The family, they're all young. Young kids, young sons and daughters. They didn't want the old lady. And we got an aunt on the other side of the family, same thing. They don't want the old people coming into their house, not because they're afraid that they're going to give the virus to them.
They were afraid of getting it from them.
From her. Right. So in other words, that's backwards. Yeah. That's like, if we're in a boat, right? Yeah. And we have women and children. There's a great movie and a book. It's called Lifeboat, and there's two of them.
I saw that.
Right. Yeah. But let me give you the premise. So the one, they're in a lifeboat, right? You got women and children and men. Now, my philosophy, if I'm in there, right, and the boat, we only have a certain amount of food and it looks pretty bad, who do we throw over? Who do we get rid of?
Right.
The women or children or the men?
Well, it's usually the women and children stay, and the men,
right.
The men
go.
They're shark food.
Right. So with this guy, what he did is he's like, no, the women are weak, the children are weak. Let's get rid of them. Throw them overboard. They're not going to make it anyway. Interesting enough, this was a true story. He did that, threw these people out, and he didn't realize, but there was a ship coming to save him, and all these people he threw out were floating around, and the ship picked him up. And when they finally got to him, he actually shot a guy on the boat, because the one guy on the boat says, "This is bullshit. I'll jump over. Don't take the women and children out." And he shot the guy. So finally, when they caught up,
what was the point of that?
Because
the guy willing to jump overboard.
No, but he wanted to take the gun away from the guy, because he was going to throw the women and children overboard. When they finally got him, they arrested the guy. They convicted him of murder and shit. I mean,
he's got the gun, he's got the power.
Yeah. So my point being is, it's your perspective. It's where we should be protecting the elderly, the weak. And they say, well, we're protecting our kids, but the argument is very weak.
Mike, we're living in a time now where we have entire countries who
scared
consider the elderly
expendable,
surplus population.
Well, you talk to the governors. Well, I don't even want to get into that. But what we did with the nursing homes, I'm not forgetting that. I'll never forget that.
That's what I'm saying.
I'll never forget that.
And that drives the point home. There are people, and there are countries who consider our seniors, our MIMAs, our PPAs, a surplus population, and to get rid of them would free up space for, say, like China.
Well, here's the thing: when the corona hit, initially, everybody was panicking. They didn't know if we had enough beds in the hospital, enough ventilators. So there's these emergency. We the United States went into emergency. State of emergency, same thing with the states. Well, when they did that, they're like, listen, we're going to triage the hospitals. The governors and even the president of the United States had sweeping dictatorial powers. And basically what they said is, let's get the old people out, and because we got to save the young people. It's one of those kind of things. So it's crazy. It's crazy how we did it. But let's get to two things I want to just make a mention is that it's screwed up here how coward we are. And I'm not going to sit in my house. I'm going to live my life. I've been boosted. I did everything I can. It's not like I'm sitting there going, I'm not going to get vaccinated. I'm going to do what I want to do. I got vaccinated. I got a booster. I had corona. You know what? I'm going to take the chance now. Yeah. If I die, I die. I mean, how much I'm going to go out. We got to do things. I'm going to work. I'm going to, they say, oh, you're going to spread the virus. So will you. Everybody's going to spread it.
Everybody's going to spread it. So what do you do? Do you stay home and hide?
Who's going to listen? If you get
the rest of your life,
but what?
Or do you go out and you take your life back?
But we all can't stay home.
Yeah, no, that's the thing.
I mean,
we can't stay home.
No, I mean, you need,
we got to go back to our jobs.
Right.
We got to go. We got to go down to the docks and start unloading some ships. We got to go back out there and reclaim our lives, because being at home, being stuck at home, being locked down in home isn't working anymore. No. It's not going to. It shut down our country, and we've got to take it back.
And when I was
on a roll there.
No, and when I was treating patients, it hit in May. March, April, May. I was on call to the ER. Dr. Kadersha, all of us.
Oh,
yeah. We didn't know how we could die or whatever. We went and we took care of patients. Was I a little bit, a little bit nervous? Yeah. I wore a mask, a shield. I washed my hands. I took my
did it?
When I went home, I took everything off. I freaking took a shower. But you know what? We did it, and then then I went back again.
Like with that kind of fear, you're talking scalding water showers, because you didn't know. But back then you don't know what you're doing.
But I mean, the thing is, I was operating on patients who were corona positive.
Positive,
so my point is now, you're going to expose to it. The other thing that I think is a tragedy, and we got to stop. And is this again? My friend's mother just passed away. She was in her 80s. She had heart disease for years, and it was getting worse and worse. She could hardly walk upstairs and everything. So she was on the banana peel, the proverbial 1 foot on a banana peel, the other foot in the grave.
Right.
And she got corona, and it wasn't really bad. She wasn't like super sick. She was talking and everything. They put her in the hospital. Nobody could see her. She's had a wave from the park. They were in the parking lot waving at her, talking to her on the phone. She was in there 2 days. She died of a heart attack. So her heart went. I don't think the corona did it. She wasn't like pneumonia, none of that. And maybe the heart just, the corona pushed her over the edge. But my point is, nobody could go in there and hold her hand. Why not? Her children all had corona. They've all been vaccinated. You know what I'm saying, Jeremy? For what reason? Or they're going to give it to her? She had it. She's going to give it to them? They had it. Are they going to spread it? Well, then don't go anywhere. You know, I mean, my point is, what are we doing, people? What are we doing? So anyway, I just want to leave that. I think that I'm not going to, go on to the Omicron and all of this and where it's going. But we are not anti-vaxxers, but we are common sense. And, pray about it. The woman who was in my office, who's got a 12-year-old daughter, I don't know what the answer is to that. Nobody does, right? Should you get her? Should you not? And I say, everybody, talk to the pediatrician, look at the CDC, go to your priest, pray to God, and then try to make the right decision. And then you go from there. It's just, so in life, that's the problem. Yeah. Life is not black and white.
Right.
I wish it was. It's either yes, there's gray. There's gray. And, if you have a hard time living in gray, you're going to have a hard time living, period.
Sure.
That's why you have so many suicides, why 100,000 people in the past year died of overdoses and drugs. We're sick. People, I'm telling you right now, go to Jesus Christ, start, that will make you a lot more relaxed.
Yeah.
All right. So let's change the subject here. We're going to talk about two things.
Yeah.
I'm sorry.
Why don't we go to commercial?
Okay. Let's take a little commercial break.
When we come back, we're going to start our syphilis special we talked about last week. And everybody wants to stay tuned for the syphilis special.
I'm going to get my phone. We're going to try something new today. We have a little commercial here. So we're going to give you a little picture here, and we'll see how it goes. All right. We'll be back in about 30 seconds.
His foot doesn't look good at all. Yeah, he's going to need surgery, that's for sure. I'll call you back when I know more.
Excuse me, I couldn't help overhearing. But if you're going to need a foot surgeon, ask for Dr. Kachmar.
Dr. Kachmar?
Yes. Saved my son's leg after an accident. He's the best.
When your foot, leg, or ankle injury lands you in the emergency room and needs the attention of a specialist, don't leave it to chance. Ask for Dr. Michael Kachmar of the Jersey Shore Foot and Leg Center. Dr. Kachmar is a board-certified reconstructive foot and ankle surgeon with local hospital affiliations near you. For over 25 years, both medical and patient communities recognize Dr. Kachmar and his team at Jersey Shore Foot and Leg Center for their expertise in the treatment of traumatic injuries and other painful conditions of the foot, ankle, and lower leg. Call the Jersey Shore Foot and Leg Center with offices in Brick, Bayville, and Barnegat at 732-269-1133. And remember, emergency room patients do have a choice.
Ask for Dr. Kachmar.
Hey, well, welcome back, everyone. Thanks for listening to that.
Welcome back, everybody. Wasn't that a great commercial?
Yeah. That was Jeremy's idea. Well, Jeremy's creation. Yeah. So I'm going to give you this doctor. I'm going to give him an accolade here. Let me see if I can pull it up. So let me get out of here. Let me see. This is.
I know you. I've known you for years now. Not once have you given me an accolade.
Yeah, I give you one right now.
That's all I ask for is an accolade.
All right, so let's. I'm going to get
it's this. Like that Rodney Dangerfield routine.
An accolade.
Give me one of these.
Yeah. So listen to this. We're trying a little experiment here. This is a syphilis talk. I just want to see where we're at here. Hang on.
All right. Who is an infectious disease specialist, a professor.
So we'll listen to this real quick. Just listen.
He came on here in his last episode and discussed naturally acquired immunity to COVID-19, which was a really fascinating episode. So if you haven't watched it yet, please do. But thank you so much, Dr. Klausner, for joining us from California.
Yes, very happy to be here. Thank you.
Absolutely.
So he's going to talk about syphilis. I'll leave it on real shortly.
Related. We're talking about another really important topic, which is increasing rates of syphilis, which is a sexually transmitted disease. But I thought, let's refresh everybody's memory because everybody's just talking about COVID. So maybe can you start out by just telling us some basics about syphilis?
So this is interesting. Listen to this.
Stages, who's most at risk.
And then I'll let this go, but listen to this.
Absolutely. Well, syphilis is one of the oldest infections of mankind. It is caused by a bacteria. The bacteria is named Treponema pallidum, and that bacteria
can you say that 3
most
times?
Commonly spread through sexual contact. But
sexual.
It can also be spread just by direct skin-to-skin contact,
Hear that?
such as shaking someone's hand, or nurses used to get syphilis if they were touching or taking care of patients who had active lesions. But that said, by far 99.
Let me make a point. There was a lot of divorces because that. We didn't know that back in the day. that it was passed that way. We thought it was only sexual.
Right.
So if your wife had syphilis and you got it from her,
Well, what I was
Woo-hoo!
what I heard first was how it's the oldest disease
yes,
known to man.
yes.
So at some point in history or prehistory, there was a caveman who had to go home, explain to his wife how he got syphilis from laying down with an unclean stegosaur.
Yeah.
Syphilis cases are spread sexually.
Yeah.
Although now what's been problematic is there has been an increase of maternal to child
This is
spread
important.
of syphilis, what we call congenital syphilis. And syphilis typically will be acquired from contact with someone else who has a active infectious lesion. So they will have some kind of sore, what we call a chancre, and that can be inside the mouth. That
I know
can
a doctor named that.
in the anus or rectum. That can be in the vagina. And the tricky thing is that lesion is often painless.
See, that's the thing; it's painless. So that people don't go to the doctor.
Their body and not know they have it.
So that's the first thing.
How one characteristic that makes it very easily spread. So it can be spread essentially asymptomatically, and then the person will acquire it. And then the person who acquires syphilis, typically about 2 to 3 weeks later, they may now develop a sore or a chancre. And again, that could be inside the mouth, could be inside
so 2 to 3
vagina,
weeks after
anus,
and I've seen a lot of these when I was
doing
doing my training.
On the penis.
But listen,
typically, when someone sees a sore or chancre on the penis, they'll get concerned and they'll start worrying about it. They may go Google about it. And typically with syphilis, that goes away in a week or two. And that's called the first stage of syphilis. Then there is a period of quiescence or
wait, hang on. Let's listen to this. Is important.
And then about 2 to 3 months later,
listen.
There'll be the secondary stage, and that secondary stage will be characterized by a rash.
And I've seen people like that. They come in with a rash,
flat red spots
legs,
on the chest or back, or the arms. May have a fever. May have swollen glands, particularly glands under the arms or groin. And often people will seek medical care for this, rash and fever and not feeling well. However, if they don't tell their clinician, or commonly the clinician doesn't ask if they're sexually active, it often gets misdiagnosed. So it's very important that
that is one of the stage now. Just listen, then I'll shut this off.
Take a sexual history whenever they see someone who may have an infection, and ask them if they're sexually active, if they've had any new partners recently. And then it's also expected that if a patient, is coming forward, with some clinical findings, that they do,
you see a lot of people with, the rash, and it's tough when you see a young girl with their parents and they got a rash on their legs.
In this area. And then
listen to this.
If it goes untreated, then the rash and fever and swollen glands will go away after about maybe a couple of weeks. And then they'll go into a prolonged latent phase. And about 75% of people then will never have any future problems.
See that?
About 25% of people, if it goes untreated, can have severe complications 10 to 20 years later. And those severe complications can be syphilis of the brain, and syphilis of the brain can be associated with dementia, change in personality.
That was
there's a lot of
famous
speculation
mafia,
that famous people in the 1700s
Al
and
Capone.
1800s.
Yeah, a lot of people throughout history had syphilis and drove them crazy.
Would cause their dementia or decline. Chronic syphilis infection can also cause severe disease of large blood vessels on the heart. So people who have swollen aorta or abnormalities with their heart valves. Often doctors will test for syphilis in that situation. And then the third kind of type of long-term syphilis can be what we call syphilitic gumma, or these inflammatory lesions.
This is what I see.
Anywhere
used to see a lot of
body. And these inflammatory swollen lesions can cause intestinal obstruction, can cause pain, and those are internal typically, and they'll only be identified.
We get some on the legs,
in that CAT scan.
Sores.
The good thing about syphilis, though, it's very easily detected by a simple blood test
and easily treated.
So the CDC recommends all sexually active individuals get tested for syphilis with a simple blood test. And then when people go to their doctor and get their blood drawn, they should ask them if they're sexually active, with multiple partners.
All right. So let me just make a point here about this. Let me just see this guy's name here, so we give him credit. So let me just go here.
Well,
so,
while you're looking that up, let me just say,
go.
If I look down and I see a lesion or a chancre, right,
a lot of people just leave it alone
on my penis,
they get scared and they don't want to do anything about it.
I'm going to be a little bit more than slightly concerned.
You'd be surprised, though.
Yeah,
you'd be surprised.
I will be.
You'd be surprised. You'd be surprised. Yeah. Let me just show people this doctor's name here. So I want to give him. There it is.
Oh, Dr. Jeffrey Klausner.
Right, and you could get that. It's I don't want to move this here.
It's not coming in clear anyway. Don't worry.
Okay, let me just see. Hang on. Let me just get it one more time.
Oh, there it is. Dr. Jeffrey Klausner discusses why
Tri-State News.
Tri-Site News.
Tri-Site. Just want to give him an accolade. So let me just make a point about syphilis, because back in the day when I started practicing, you could not get married. So when I started practicing 88, 89, right around 90, I finished my residency. You could not get married without a syphilis test. You could not get, how do we do this here? You like that, right? You could not get married. So you would have to go get a syphilis. They used to come into my office, right? And you like that. They used to come in my office and other doctors' office and ask for a script to get a syphilis test. So it was very prominent. And it was all around the place. And we would see, you could get the, infections in your legs and stuff. So, and there was about somewhere, I don't know where, probably the late 90s, they stopped that. And so we don't routinely check for syphilis. And it was pretty much, not eradicated, but we didn't see a lot of it. Now it's starting to come back. And, you say you get a chancre, but if you get it by your hands or something like that, you may not get it that way. So
so it's going to be elsewhere.
It could be elsewhere. You get a sore in your hand. Right. Now, I don't know how common that is. But all I'm saying is that the real thing is every once in a while you should get some blood work done.
Yeah.
And you should get maybe once a year.
Yeah. And maybe just maybe, stay away from hookers.
No. Listen, I understand, but my point about this is a public announcement. When you get your blood work every year,
right?
You check your liver, your kidneys, get a syphilis test. It's a blood test. Just ask the doctor to check for syphilis. Okay. And if you got it, it's like one dose of penicillin. And, you say, okay, 75% of the people who get it will not have any problems. But 25% of the time, I mean, it could kill you. I mean, you could be in bad shape.
Right.
So I wonder, and so what I do is.
What happens to a happily married man going to his doctor, asking just out of the blue for a syphilis test, finds out he has syphilis, and then has to stare his wife in the eye? Like, what's going on there?
Well, I had that with a patient of mine. First of all, that's good. The doctor doesn't have to tell the wife. You tell the husband.
Yeah.
And I would if you really want to be sneaky about it, the husband should go to the wife's doctor and say, listen, when you get some blood on her, do a test. Yeah. But I know. Listen, I had a guy. I'll tell you a quick story. This is a great story. I was working with Dr. Toro, and we shared an office together. So we would get these patients in, and one day a guy came in with his leg was all swollen, and his knee looked like he had an infusion. And I said, Joe, I was going to kick him over to Joe because Joe does a lot of knee stuff. And Joe says, listen, I'm not going to be there. So I drained it, and I could see it was pussy. And I put the guy in antibiotics, and I kicked him over to Joe, because I figured Joe may have to operate on him. And the guy came back, and he was feeling better, but came back gonorrhea, positive for gonorrhea in the knee.
Oh boy.
Now, gonorrhea is another sexually transmitted disease. And at this time, there's no HIPAA, and he came in the room with his wife. And I don't remember, the whole thing, but we basically, they wanted to know what was going on. I said, well, you got gonorrhea, you got a bacteria in it. And they're like, well, where can you get it? Where'd you get it? Well, I'm like, well, I think that was probably a really tough situation. We found out later on he went down to Mexico for a wedding or bachelor party or something like that, and he picked it up and it went in his bloodstream and it settled in his knee. So that's
you can just pick it up.
I don't know about gonorrhea. I'm not a real specialist in sexually transmitted disease. I can tell you right now, I talked to my infectious disease doctor just before Corona hit. We were talking about, she runs one of the VD clinics, and this is, in the Toms River, Ocean County area. Right. And she says what strikes her is the age of the kids coming in. It's a lot of girls too, because, but the age of these girls and boys coming in with sexually transmitted disease at such a young age, 14, 12, 13.
Jesus Christ.
As soon as they can have sex, they're having it.
I'm thinking about husbands and wives. Like, well, where did you get gonorrhea? Well, I was sitting on a bar stool. Now, I mean, it's crazy. These, but getting the kids as young as they are getting it, I mean, that's nuts.
Yeah, it's nuts. And the thing is why I bring up syphilis, because, you can get sores on the lower leg, but I can tell you, I've been asked multiple times by, patients come in, they might have they got rash on their legs, a little bit, and on their arms, but they come into me, and they got it, and I say, you got anywhere else? Oh, yeah, it's on my back, and I'm sitting there, and the mom's there, and typically, it might be like a 18, 16, 17-year-old girl, and the mom's like, what do you think it is? And I'm like, I'm like, well, you know what? Because I said, you might want to go see a derm, or your primary doctor. Right. I say, no, I don't know what it is. I said,
it could be anything.
But I said, listen, you can't let this go. It could be, and I say, what I usually say is, listen, it could be an infection. It could be a virus in your system, but you got to get a blood test, and it could be syphilis, So if you're sexually active,
is that transferable through pregnancy?
Yeah, that's the real problem about it. That's what I was asking. That's where, so now I believe the protocol is that if you get pregnant, they're going to test you for syphilis. And then
it can pass on to the child.
Oh, yeah. Yes. Oh, that's really big problem. Okay. Yeah. And that's really bad. It could blind the kids. That's why.
Oh my God. It can blind them?
Yeah. What I think they do.
So they come out blind.
No. Yeah. What they do is they put something in their eyes as soon as they come out, in case the mom did have syphilis. But Jesus. I'm dating myself. Listen, I didn't prepare to go into that aspect of it, but I know that this doctor here,
come on, you got me sitting across from you.
If you listen to his whole lecture, which I strongly recommend people go and listen to it. Yeah. And you could go back on the video and look at it. He says that, they recommend testing the woman. They first get pregnant, in the middle of pregnant, and the end and they're pregnant, because a woman could have sex while she's pregnant. So, you test it all the way through. And, but I think that's one of the reasons why these kids would have back in the day, there was more blindness, because a lot of kids would be born of a mother who had syphilis, and it would whack their eyes out. And I think they used to put, what did they put in their eyes? Silver nitrate? I don't remember. Dilute something. Yeah. You could Google it. Now you're getting, it's not my specialty, so I don't really remember, but I know, but that's why it's important especially if you're going to have a baby or get pregnant.
Can't you get poisoning from silver nitrate though?
Yeah, maybe it's dilute. You could dilute. I mean, you could listen, you could drink bleach, you could put bleach in a pool. I mean, you swallow a mouthful of pool water, you're swallowing bleach, chlorine. Yeah. So it's at the levels, it's so that's the interesting thing. I just want to throw it out at you, because it appears that it's getting more and more out there, and it's never left us. It's one of the oldest infections, just like tuberculosis is another one. But I just want to throw it out, is that it's the tragedy about this is it's simple to test for. Just ask your doctor for a blood test while you're getting your normal blood test. And from what I understand, it's still very susceptible to penicillin, and even maybe one dose. So you can knock it out. I mean, I'm not saying, the other thing you could do is, some people might say, well, let me just go get some penicillin and I'll take it, and that'll be the end of it. But, I think it's a good idea to get tested, because, you get tested.
Because you've also slept with people. Okay, if you're sexually
Well, no, he
active,
said that he just said you could get it with a handshake or stuff like that.
Yeah, but also if you are sexually active and you find out that you have syphilis, so I don't know if you're married or if you've got.
Oh, you gotta go tell people who you had
you've
sex
gotta
with.
go and tell them.
Ooh,
See, that's what I'm talking about.
I
So it's not so cut and dry. What you know?
Well,
I'll just take some.
Listen, this doctor who's on
penicillin and I'll be fine. But
no,
what about all these other people you've been bumping into?
What he says is that you could test through him. You could call him up or send him an email, and they'll send you a test kit and all of that. I think what happens though is if you test positive for syphilis, the Board of Health, they're obligated to send that to the Board of Health, and they're probably going to contact you, but it'll be very confidential. And then they'll ask you who you slept with, and then they'll probably go talk to those people. I mean, hey, listen, you know, you worry about spreading corona. I mean, you could be spreading syphilis.
Just imagine.
Oh, knock on the door.
Oh, Mrs. Sullivan. Yeah, hi. No, we just got to talk to your husband about what? Oh, syphilis.
Yeah. Oh man.
What are you gonna? Oh my God.
But I think that well, there's when I talk about prophylactic, so I just want to let people know I see more and more that I see it in the CDC. I see it more coming out in literature that it's happening more and more.
I dig it, guys. I dig it. We were all under lockdown for quite some time, and not all of us had a missus with us. Okay, so yeah, you're gonna want to go out. You got some oats to sow or whatever, but the same thing goes. The same thing you tell your kids or whatever. Use like contraception. Protect yourself.
Yeah.
You don't want to have those uncomfortable moments where now you've got to go and tell everybody you've ever been with that you have syphilis or you've got gonorrhea. I mean, that's the thing we all cringed about in health class in high school.
You don't want to tell. You don't want to tell. Yeah, that's a bad omen. So let's change. So we have something else we're going to talk about. How much time we have? So we're getting there. So let's go. Case of the week.
Case of the week.
Because we used to do this all the time. And, people who are listening to us, just so you know, this is what we used to do. We talked about medicine before Corona hit. And Corona sidetracked us. I'm getting tired of I'm tired of talking about Corona. Really, Jeremy?
I'm tired of Corona. I never get tired of politics. But I get tired of Corona.
Yeah, I know. Politics is good, but we try to, we could change this, but I still, I think that we may have a third show coming up, or I might have to jump in with Barbara, and I'll get involved in the politics because I think I'll be a guest. But for now, we got the medical show, we got the lifeguard show.
This is just a little hint. We are toying with the idea of my 2 radio shows coming to podcast.
Yeah, coming to podcast.
Yeah,
video podcast, video
podcast.
Live video.
It's
podcast.
going to be much better than it was, and we've got tons of followers as it is. But we are going to be joining the Kachmar network, and we are very kind of happy with that. But we'll see. I mean, everything can change tomorrow, but we're going to see.
Right. And we're up in our game as far as technology. So anyway, let's go to the whiteboard. So that's our whiteboard over there, and we have our stuff up. So there's syphilis. So now there's one thing I want to talk about is called vasculitis. And any idea, Jeremy, what vasculitis is? Just take a guess by the word. What would you say?
It has something to do with vascular type stuff.
Well, what does itis mean usually? Itis.
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 It's usually something bad that's happening to wherever it's attached to.
Inflammation.
All right. Okay.
So inflammation is itis.
You can see how much I don't know.
And vascular kind of means like the veins and arteries.
Yeah.
So it's inflammation, specifically inflammation of the arteries.
Now, this is Tom's bread and butter right here, right?
Well, yes and no, not necessarily. I mean, vascular surgeons do see it, but really.
When are we getting him on this podcast, by the way?
Soon. I want. He just had Corona, so he's coming around from. He had a heart. Everybody knows he had a heart. Excuse me?
He made it through Corona?
As far as I know, he's still alive. I'm going to call him today.
I got to tell you something. He's one tough bastard.
Yeah, he is. So people don't know he's a general surgeon. But a lot of times it depends on the cause of the vasculitis. That's what I want to talk about a little, because I just had a patient who we diagnosed with vasculitis who was sent to me as like a fifth opinion. And I want to make, because I want to talk about it a little bit. It's a really good story. But a lot of times these people with vasculitis will land on a doorstep of a rheumatologist, believe it or not, because a lot of this is associated with what do you call it, a rheumatological disorder. Or the other one who sees these patients is an infectious disease doctor, because sometimes these are secondary to hepatitis C or B, hepatitis. So let's just talk about how this presents and whether or not you have it. And there's other reasons for cellulitis. I mean, cancers, and there's hypersensitivity vasculitis. It could be medication, drugs. There's a million things, but what basically happens is you get inflammation of your arteries. And a lot of times what that does is cause pain and also discoloration. One of the things that I see on the leg is we use the term fishnet stocking vasculitis. You ever see the fishnets? Remember the old fishnet stockings, Jeremy?
Well, I know the ones that are on women's legs.
Yeah. So you know how that pattern, that's actually how the vasculitis looks. The leg is, you get this red fishnet pattern around the legs going, and the toes are a lot of times purple or bluish. And you got pain, you got like little lesions that start to develop, very painful. It could be only one leg or the other leg.
During World War II, it would have saved a lot of time penciling them in on the legs, with the soap shortages and stuff.
So let's just talk about how this is usually diagnosed, and we won't spend a whole bunch of time, but there's a lot of people who come to me. They don't have a vasculitis. They have what's called Raynaud's disease or Raynaud's phenomenon. And this is this thing where when you go outside in the cold, your hands, your fingers, your toes, they'll turn white, and then they'll kind of get like dusky blue. And then when you go into the house, they get bright red again.
Right.
And what that is that's an abnormality of the Huntington's response. Now, I don't want to get you to glaze over, but just follow me.
I'm not going to glaze over because I'm thinking I'm terrified, because I remember a point in my time where my fingers looked like that. After those situations you just said.
So there's a normal response. It's called the Huntington's response.
So this is what I got now.
Right. So what happens is when you go outside in the cold, your body shuts down the blood supply temporarily to your nose, to your ears, to your hands, to your feet, and it corrals the warm blood to your center, to your core. So it shuts all the blood off, and then it puts it back on, shuts it off, puts it back on, till the point where your ears and nose and fingers get cold. They're colder. It's the body's way to protect you, to try to corral your heat centrally. You follow? Because that's when you see these people who get like Mount Everest and they get caught up there. Where do they get this frostbite and they lose their fingers and everything? It's their fingers, their toes, their nose, right? Tip of their ears, right? And that's how it works. Now, that's a normal response. And what happens though, when that thing gets wacky and you go outside and it just shuts off and stays that way,
right?
You get ulcers, you let your feet and your hands stay that color all the time, and they get painful. You could hardly move them.
Yeah.
So
when if you try to bend your fingers, it's almost like, oh, something's stopping you.
Yeah, I got some. If that's associated with a rheumatological disorder like lupus or
it feels
rheumatoid,
like your skin is stretching.
Right.
To its limits.
Right.
Yeah.
You can't move. If it's associated with a other disease, it's called Raynaud's phenomenon. If it's standalone by itself, it's called Raynaud's disease. But this is different than a vasculitis per se. They look the same, but what it is it's nerve mediated. Your nerves, your small vessels in your nose, your hands, your feet, the arterial vessels are controlled by nervous system. So when your nervous system is wacky, it shuts everything down. And it's usually cold related. You followed it? Okay, that's what that is. So your nervous system is spasming out the blood vessels. Interestingly enough, that's a good thing if you have Huntington's response. When people drink alcohol, like remember what's that big dog that they used to go out? They send Saint Bernard
with the big barrel
of booze, right? And you drink
it. Brandy or something.
The worst thing to do is to drink liquor, because liquor is a vasodilator. It will open up your arteries. so you'll get frostbite quicker.
So these canines were killing people out in the.
Well, the thing is, you didn't feel it. I mean, it was best. There was a painkiller. I mean, you got drunk and that was it. But I think what I would have done is if that happened to me, I would have grabbed that dog and kept.
Do they still have those dogs today?
I don't know, but there was just a story where a girl who got lost in somewhere where it was cold, snow and everything, and there was a stray dog. Dog must have came there. She hugged the dog for hours, kept her warm.
And the dog was like, "Let me get you a beer."
If you remember the movie, what was the movie? Was it? I think it was DiCaprio. It was one of those Western movies. What he did to stay warm, he shot an animal and jumped into the gutted it.
Empire Strikes Back. Han Solo sliced open a tauntaun and put because they were on an ice planet. And he put Luke Skywalker's body inside of it to keep him warm.
Okay. Yeah. So I mean, that actually happened back in the West days. I mean, if you could keep yourself warm, but getting back to the that was a good a good, what do you call it? But vasculitis. So now there's but the other. So that's Huntington's. That's what we see a lot of that, and I see it in the wintertime. And when you go to the warm weather, it goes away and you're fine. But then you have another thing. It looks the same, so very similar, but it's vasculitis, which means it's an inflammation of the arteries. And what it does the same thing.
So now back in the day, this is like early days when I first met Mike. He was a guest on Dr. Jasper's radio show. And we were walking out, we were going down the elevator, and Mike broke out his phone and he's showing pictures of a patient's vascular system there, right? Or and I saw like the lines of the veins, and then they'd stop, and it was just blackness, and then they'd pick up again down below. Is this what we're talking about?
No, that was a that was a venous, that was an arteriogram.
That's something I'll never forget.
Right.
Never ever forget.
What happens here? So the small vessels, mostly of the skin, it could be deep, it could be big vessels too. Don't get me wrong. They get inflamed. So when they're inflamed, your blood supply is not working right. Okay. You could get clots. You could get, impeded blood flow. Right. Let's put it that way.
Right.
And it's painful. So usually the temperature doesn't matter. And it could be, the thing with it is to make a diagnosis clinically. And I'm telling you, I can show you pictures. The toes and the feet are purple. I mean, they got that, they look terrible. There's a rash, usually like a red stockinette kind of thing going up the leg, and it, you got it. So what it is inflammation. So how do you deal with it? You got to make a diagnosis. So one thing you could do is biopsy it. There's a thing where they actually take a biopsy of your up in your neck area of the artery. All right. And but we could take a biopsy and you look under the microscope. A lot of times with the biopsy, it'll tell you it's a vasculitis, but not what causes the vasculitis.
That's what I was going to say to you. Like, if I see something that looks exactly like what you just described, and I do nothing about it, and it just nothing ever happens, can that happen? If you see it, you do nothing about it, and then it just goes away.
Well, it can go away, and but the thing is, you to answer that question, you got to know what's causing it.
Right.
So let me give you what things could cause it. Okay. Then I'll tell you, some of those things ain't going away.
Right.
Which means the vasculitis may not go away. So a lot of times what will happen is you'll go to a vascular surgeon. He'll look at he or she will look at the arteries and say, your circulation is good. The big vessels are fine. This looks more like a vasculitis, and they'll send you to the rheumatologist. Because the rheumatologist will do a whole bunch of blood work. A lot of times, again, these vasculitises could be secondary to a rheumatological disorder. So can Raynaud's phenomenon, but understand they're different things.
Right.
And so now what you do is you get all this blood work done.
Raynaud's phenomenon.
Raynaud's,
sounds like a nebula in deep space.
I know.
Yeah.
So you get the blood work. One of the big things that you got to make sure you look at lupus, rheumatoid, scleroderma, all of those.
Lupus.
I know lupus is a bad one, but you get all the tests. And then the other one that's a big one is hepatitis. So people have, and some people have hepatitis C, they don't know it. Now that was sexually transmitted.
But don't you get like a yellow tinge in your skin?
No, not necessarily.
necessarily.
No. And the thing about hepatitis C is you could cure it now. There's medication for it. But if it sits there, like again, it's just like syphilis. There's a certain amount of people with chronic hepatitis C, it'll whack out their liver.
Right.
Other people, it won't. But in this situation, it could cause vasculitis. So you need to rule that out. I look at other things too. I look at the, Lyme's disease. I always think that that's a good thing to do. Of course, if you want to look at syphilis, but you got HIV, they check you for that. So the rheumatologists are really pretty good, the ones that I deal with, and they test you for everything. And then there's sometimes there is no rhyme or reason. You can't find out why these people have it. And sometimes they'll get it once and they'll never get it again. Or some people have a really hard time with it. One of the things you can do is the treatments out there are steroids, oral or topical. Usually it's oral, and you got to load up on it. And what does the steroid do? It reduces the itis, reduces the inflammation. So steroids is one way to go. The other thing they do is what's called phonophoresis. They actually they do something with the blood. They thin out the blood. You also got, I've seen this too in this discoloration with elevated platelet counts. So again, blood work is important.
Right.
Just like I had a lady come in, a few years ago, and she had superficial inflammation of the vein. We call that superficial venous thrombosis.
Wow.
Okay. And it was like a superficial vein. And I looked at that. It was out of the blue. I went and got blood work on her, and she had leukemia within like about.
Why venous? Because she was a woman?
No, it just happens that way.
Oh.
A lot of times leukemia will inflame the vein. So it's superficial venous thrombosis. So it was inflammation doesn't necessarily mean a clot, but it was inflammation of the vein. And you need to.
I'm always curious about the origins of.
Yeah. So you get, but I had a lady also, she came in, she had discoloration. I thought it was Raynaud's phenomenon. It was in the wintertime, but I said, let's just do the blood work. And her freaking platelets were banging. She had a leukemia. And you got to be really careful. That's why you need to go to a doctor who has a lot of experience, has an idea of what it could be. What are the differential diagnoses? And this is what a lot of people, what are you looking, Jeremy? We have some comments.
Janelle Duffy,
What's
says,
she saying?
Say that whole venous thing 5 times fast.
Venous, yes. Superficial venous thrombosis. Yeah, she's so yeah, she's one of our listeners. Her mom had corona really bad. Joanne, she always calls in. She's Joanne, Janelle.
How's she doing now?
I think she's coming into rehab. I think she's coming home.
Really?
She was on a ventilator for a couple months.
Oh, Jesus.
Yep.
We love our Duffys.
Yeah. So, what was I going to say? So the vasculitis is a real problem. You got to find out what's causing it. And sometimes you need a biopsy to do that. And that could help.
She says she's on her way.
Good. So Jeremy, that's our case of the week. These are tough cases out there. We see a lot of it, but getting back to us, if you have these problems, come and see us.
Yeah.
And I'm going to throw my phone number out there. It's 732-269-1133, 732-269-1133. Our webpage is JerseyShoreFootandLegCenter.com.
That's right.
And email us at drkachmar@icloud.com.
Mm-hmm.
And we're here. So
and on YouTube, please, and any other platforms, please subscribe now and turn on those notifications. For YouTube, I know it's a little bell. You just click on that and it says like, do you want all? Do you want some? Do you want none?
Right.
Press all. What the heck? We do a show like once or twice a week, but you'll know about it and you can be part of it then. Just like our Duffys. We love our Duffys.
Yeah. I try. They're what do you call it? They've been
with us the entire time we've done shows. Yeah.
her mom,
they were with us from the old show to,
to
now. They followed us over.
Yeah, they've been long-term listeners.
Yeah.
So why don't we, Jeremy? I think we had a pretty good day. It's an hour and 10 minutes. So why don't we pack it in? Everyone, listen. Thank you for tuning in. We like our politics, but we like our medical show
we like
too.
our medicine too.
And I think these things that we talked about are really good. It's a little blip out there. And if you want to continue to watch us, we're usually on every Friday.
Yep.
Around this time.
Friday around 1-ish.
Right.
Yeah.
Right. We're on YouTube, so you could go watch this. If you hear this on the podcast, if you could go to the YouTube and watch it.
If you're in your car and you got Spotify, that's a great way to listen to us. If you got iTunes, if you got Audible, if you got Yahoo, Google. Everywhere you can find a podcast, you just type in "Scrubbing Up with Dr. Michael Kachmar," and then we will pop up.
Right.
And listen to us, and we have a ginormous archive out there. We archived a lot on our Facebook page.
Yeah, I should put some more of them out. Yeah, I still have a lot.
We got a lot of archive from our old shows, and those are great shows. The information we say in them are still good today.
Right. Right.
And that was before all of this mess with COVID.
Right. So everyone, just to remind everyone, this is a medical talk show. These are our opinions. We don't, if this is where you start your information at. And
not where it finishes.
No.
Okay.
And we also say, listen, be nice to everybody.
Be nice, be kind. It costs nothing. And the price has never gone up.
Right. So next week we'll have a little show. We'll start again with a little politics. We're doing some research on Corona. I want to talk about the Olympics. I don't know what's going on there in China.
I can't even wait. I've been waiting quietly about that for months now because I know that's going to be some kind of brouhaha.
Yeah, there's something going on there. Right now, CNN or CBS and ESPN are not sending any of their commentators.
There's a lot of turmoil out there.
Something's going on over there.
Yeah.
But that's another, you could probably talk about it tomorrow. Oh, yeah, you can tell everybody about your show this tomorrow.
Oh, yeah.
Two shows.
I got 2 shows tomorrow on local radio. It's 104.1 FM, Painless with Dr. Gabriel Jasper from 10 o'clock to 11, and Radio Free Tom's River from 11 to 12 with Dr. Barbara Schneider. That's our heavy political show, but it's got a massive following.
Yeah, that's a good one to listen to.
Yeah, if you want to, these are the 2 shows that I think might be possibly joining our big Kachmar Network family.
Yeah.
So if you want to get a head start and find out what they're like, you can check them out. Go to their Facebook pages. Go to,
Yeah, we're going to have to, Dr. Schneider, Radio Free, Tom's River with Dr. Michael Kachmar. So tomorrow I won't be, I don't know if I'm going to be able to listen. I got to do my Coast Guard thing. I have training tomorrow with the Coast Guard. So I got to do that. And my Coast Guard auxiliary training.
Polar bear swimming?
It's just core training. I got to go. And I love the water. I love that whole thing, the Coast Guard and the.
Are you out in the ocean when you do this stuff?
No.
This is in a heated pool.
No. This is actually academic. In a room.
I got
No, these are courses. Yeah. But I want to get out there. I have my captain's license. I have a master's captain's license.
Yeah.
I've had it for many years.
Captain. Doctor.
Yeah, I've sailed all around the
Captain.
Not all around the world, but all around the country. The Caribbean. Yeah. I actually might be going down there in May. For a little sailing.
Okay.
So we'll see. It's because of Corona, everything was put off on hold. You couldn't go anywhere. I'm really dying. It's been a big.
You've already made up your mind. It seems you're taking back your life.
Yeah, you know what? I've had Corona. I'm been vaccinated. Yeah. I'm hoping what's going to do is basically everything's going to calm down. We're going to get a vaccine every year, just like the flu. There's going to be variants. It's not going to be killing millions of people. It's going to be like the flu. Some years the flu killed 60,000 people, 80,000. Maybe it's going to be like that, and then we're going to have therapeutics where we can really help the people who were vaccinated. To get back quickly.
I hope it's not a yearly thing. I hope this could be like squashed, like
I don't think so.
Or something like that. One of those big things.
Listen. There's still measles. I think what's going to happen is that we're going to have this for a long, long time, but we can manage it. It could become manageable, and we got to get the politics out of it. We got to get therapeutics. The therapeutics are there, Jeremy. The monoclonal, the
We got to get the politics out of it. We got to stop weaponizing medicine, and we got to start.
You got to let doctors treat patients. You can't be
together.
locking up. You can't be locking up doctors who are given, hydrocortisone or Z-Pak, whatever. But the thing is, getting back with the therapeutics, with specifically the sequential multi-drug monoclonal antibodies, we should have tons of that. So hopefully, the pills coming out with Pfizer. I think you're going to see. There's Texas working on another vaccine, a real vaccine, a virus vaccine. So and they'll come out with another vaccine that's more tweaked to go after the new
specific.
Well, that's what happens with the flu vaccine. Every year it's tweaked to try to anticipate the new one that's coming around. That's where they're going to be chasing it for a long time. Be chasing it. I think what it is that sort of like somebody, I don't know. We wounded it. It's some like alien. We shot it a couple times in its legs. It's crawling right now. We ain't gonna catch it, but we could slow it down a lot, and I think we could get back to our lives. That's the key.
That's the hope.
Right, and it's time. But I think we're hopefully we're around the corner. But this thing has been really rough. It's been over 2 years, Jeremy. It's been a long 2 years. It's been a long time. So anyway, listen, everyone. Jeremy, say goobye. Let's get the music going here. We're going to say goodbye.
Be kind. Remember that. It's important. Be kind to each one of us, We're all dealing with our own stuff, and holding the door open for somebody, it can make them break a day, All
right. Listen, everyone, we're going to be signing off. We'll let you listen to the music for a few seconds. We'll give you a beautiful view of our studio here. And we're signing off. Thank you very much, and we'll see you next week.
Thank you.